I'd like to talk about the intravenous therapies that we use and that are commonly used in the care of cancer patients. You know that when you have the diagnosis of cancer, one of the first things that happens is you have to have chemotherapy. Well, chemotherapy is given in large doses, and those are very toxic and very dangerous drugs, and they always have some pretty severe side effects that many people are familiar with. Well, there's a way of doing treatments using the same chemotherapy drugs that targets tumor cells and doesn't have the side effects. It's called insulin potentiation therapy, or IPT. The technique of using IPT uses very small amounts of insulin to help drive the blood sugar level of the blood of the patient down, which actually starves the tumor cells and makes them very vulnerable. And then for a few moments, while that vulnerability is at its most, then we give very small doses of the same chemotherapy drugs. Now those are targeted directly to the tumor cells, so there's not enough left over to give you side effects like the traditional chemotherapy. So it's much more effective and an efficient way to deliver the same medications. People don't get hair loss, for example, or the nausea, or the immune system is sacrificed, and all the common things that happen during conventional chemotherapy. But the chemotherapy alone is not enough. There is another way of doing treatments, and we call that oxidative medicine. And what that means is that natural healthy cells in the body have to use a process called oxidative metabolism to be able to take the food that we eat and to convert it using the air that we breathe to the energy, the forms of energy the body cells need to stay alive and healthy. That process is oxidation. So there's a number of intravenous treatments that support oxidation, and collectively we call that oxidative medicine, or to be short, OxyMed. So OxyMed therapies always increase, enhance, and support the bodies, the cells, the immune system, and makes things stronger and healthier. Where on the other hand, chemotherapy always has a suppressive effect. So we use little doses of chemotherapy to minimize the harm to the body, and lots of oxidative medicine to maximize the healing effect to the body. So a traditional course of treatment, a regular course through us, is going to involve some of both. Oxidative medicine usually first and often for several days, and then we start to add in the IPT with chemotherapy as needed to help balance out the treatment and give the patient the maximum or the optimum kind of benefit from their course of therapy with us.